Mrs. Gerard has suffered from multiple sclerosis for several years and is confined to bed, as she is unable to endure any other position. She still has some mobility and strength in her arms, and therefore she is capable of turning over in her bed, with assistance, however. She requires complete personal care in bed. Prior to starting any intervention, the PSW checks the user's care plan or attendant's handbook for her needs and condition. This allows to find out if the user has any special needs and or limitations. Hand hygiene is essential to remove any microorganisms. The PSW gathers all the required items before starting to save time and avoid having to temporarily stop the procedure once underway. She ensures that all materials are placed on a clean, dry surface to prevent any form of contamination.
Good morning, Mrs. Gerard.
Oh, good morning.
How are you?
Oh, I'm fine. And you?
I'm good, thank you. My name is Cynthia, so I'll be your caregiver for today.
Okay, nice to meet you, Cynthia.
Nice to meet you. Is this a good time to do personal hygiene?
Oh, yeah, that would be okay. That's fine.
Perfect, so I'll go gather everything I need, okay?
Okay.
Checking the user's ID bracelet, addressing her by her name is essential to make sure the right care is given to the right person. The PSW makes sure the user is receptive to personal care and that this is a good time to proceed. She ensures the user's consent. This is essential of any type of intervention. If the user asks for further information concerning the personal care procedure, it must be explained to make sure she understands and is ready to cooperate. Closing the curtains or shutting the door is essential to protect the user's privacy. The PSW ensures sufficient lighting prior to starting the procedure.
Are you able to turn on your side by yourself? Or do you need to go get someone for assistance?
Oh, I still have a bit of strength left in my arms.
Perfect.
Yeah.
Okay.
Yeah.
The PSW checks the user's autonomous movement ability to prevent accidents. Users should be encouraged to continue doing what they can to preserve their physical abilities instead of doing everything for them. Suggest activities that are within a user's capacities. She ensures the wheel locks are properly secured to prevent accidents. Also, the bed should be adjusted to hip height in line with PDSB standards to prevent injuries to caregivers. Having all necessary materials within reach is good practice and saves time and effort. If the PSW is required to leave the area, the side rail must be raised and the bed lowered to its lowest position to protect the user.
I'll be uncovering your body, but also just keeping you covered during the whole bath, okay?
Okay.
Lift the sheets to keep them dry and unsoiled. Cover the user with a towel for privacy and warmth. Uncover only the part of the body to be washed and then move on to the next. Suggest the use of the bedpan before you start to avoid having to use it halfway through the procedure. The PSW washes her hands first. She then fills the wash basin with warm water to ensure the user's comfort. If she needs to leave the room to do so, she raises the side rail and lowers the bed to its lowest position first to ensure the user's safety. User safety must be a #1 priority at all times in PSW practice. Checking the water temperature will prevent burns to the user's skin.
We're going to start by washing your eyes and your face, okay?
Yeah.
Suggesting to the user that she wash her own face is a way to help preserve autonomy. Also, the face being very personal, some people do not like being touched there. Wash the user's eyes with clear water from the inner region outward. Use a separate corner of the washcloth for each eye to prevent transferring fluids from one eye to the other.
Do you prefer to wash your face yourself?
No, could you do that for me?
No problem. Okay. Do you want me to use soap for the rest of the face?
No, I prefer just clear water from my face. Yeah.
Perfect, okay. Okay, just gonna dry it a bit. Okay. So we'd be to do your arm, okay? I'm just gonna do your left arm, okay?
Okay, yeah.
Explaining the procedure to the user shows respect for the person. Placing a towel underneath the arms protects the bed linen.
I'm just gonna start washing, okay?
Okay, yeah.
Washing from the ends of the fingers all the way up to the underarm with firm movements activates the bloodstream. Then, rinse off the soap and dry, dabbing with the towel to prevent skin irritation. Once done, the PSW will transfer to the other side to wash the user's other arm.
I'm just gonna lift your arm. I'm gonna go under. Okay, okay.
Yeah.
Perfect. All right, we'll cover your arm here.
Yep.
Okay. And we're gonna do your other arm, okay?
Okay.
Perfect. So we'll continue with the torso, okay?
Okay.
The PSW places a towel on the user's chest, then washes, rinses, and dries, paying special attention to the breasts underneath and the umbilical area. She also pays special attention to skin folds to prevent irritation, redness, and even mycosis, fungal disease caused by moisture. Then, the user is covered with a towel or clean linen. Check for any skin anomalies and notify the nursing staff if necessary.
You okay?
Yeah.
So we're just going to rinse, okay? So we're not going to do the legs, okay?
Okay. Yeah.
I'm just going to put a towel underneath your leg here. Okay, and then lift your leg, lift your foot. So I'm going to start by your ankle and go all the way up, okay?
Yeah.
The PSW washes and rinses thoroughly, then dries, dabbing with the towel. This procedure prevents venous status. Once done with the left leg, she will repeat the same procedure for the right leg.
So I'm going to rinse. Okay. So I'm going to do your foot, okay?
Yeah.
When the PSW conducts foot hygiene, she must pay special attention to any signs of redness. She must also be sure to clean between the toes to prevent buildups and check for anomalies. Checking the heels of a person who is confined to bed is also important because there is a high risk of pressure ulcers. If the PSW notes any anomalies, she must notify the nursing staff.
No pain to your foot?
No, I don't feel much, but
Once the left foot is clean, she will continue by cleaning the right foot. The PSW also makes sure the user is comfortable
we'll do the
and
other leg,
warm.
okay?
She raises the side rails and lowers the bed to its lowest position if she needs to leave the room.
Perfect. So we're going to do your back, okay?
Okay.
And then we'll do your buttock hygiene after.
Okay.
Are you able to turn to your side?
Yeah.
I'll be helping you.
Okay, you can help me.
I'll be helping you, yes.
Wait.
Take your time.
Okay.
Hold on to the bar. Perfect.
Like this?
Are you comfortable?
Yeah.
Perfect.
The PSW asks the user if she can turn by herself. This helps in maintaining the person's abilities. The towel or piqué prevents soiling of the bed linen and mattress. The PSW washes the user's back as indicated.
Okay, I'm going to rinse.
Okay.
Okay, now we're going to dry your back.
Yeah.
I'm just going to put some cream on your back, okay?
Oh, yeah, that's good.
Applying moisturizing cream after washing improves the bloodstream across the back, improves skin hydration and comfort.
Okay, we're going to do your buttock, okay now?
Yeah.
Non-sterile gloves protect the PSW from becoming exposed to and contaminated by biological fluids. During the procedure, the PSW checks for any redness, wounds, and/or irritation. She cleans the anal cleft thoroughly, where pressure ulcers often develop. The nursing staff must be notified of any skin redness or alterations.
Any pain?
No, it's okay.
Perfect.
Yeah.
Okay, I'm just going to dry out.
Yeah.
Okay, so we're going to turn you slowly back on your back, okay?
Okay.
Are you comfortable?
Yeah, I could just fix my pillow a little bit.
Yes.
Oh, thank you.
Okay. Now we're going to go on to your private parts, okay? Your genitals. I'm just going to go change the water first, okay? And then I'll be right back, okay?
Okay.
We're now doing the genital areas.
Okay.
Okay.
Yeah.
Are you able to do yourself?
No, I'd rather you do it. I want it to be done well.
No problem.
Okay.
The PSW puts on new gloves to prevent infections. Female genitals are cleaned as follows, front to back from the pubis to the anus. First, the caregiver washes the greater lips front to back, then separates the greater lips from the lesser lips and washes front to back using a clean part of the washcloth at each stroke. She makes sure to clean all the folds thoroughly by opening the lesser lips and cleaning around the external urethral orifice and vaginal orifice. If soapy water is used, rinsing with clear water and a new washcloth is essential. Dry with dabbing motion. Male genitals are cleaned as follows. Dilate the foreskin, wash and rinse the glands with circular movements towards the tip. Dry with a clean towel. Wash, rinse, and dry the body of the penis and scrotum. At the end of the procedure, the PSW removes her gloves and washes her hands. Then, she helps the user put on clean garments. She helps the user with putting on hearing aids, dentures, and glasses as necessary. She makes sure the user is comfortable and cleans up her materials. She proceeds with hand hygiene at the end of the procedure.